Look at this beautiful little puppy right here. He is so inquisitive. He seems to be very happy.
Oh, yeah.
And relaxed because he just had a little yawn. He's probably thinking of kibbles and bits right now. Hey, look who's here. It's the Pet Patrol. Good morning.
Good morning, Dan.
Good morning to you, Sandy Lampy.
Doesn't Jack look great?
Is that his name, Jack?
Jack?
That's
yeah.
a great name.
Jack is a patient that
Jack is a
has had
patient.
this surgery.
Okay, well then
So-
that is beautiful.
I know. So we're going to talk to Don Leisure Fitness first about what do you do if you see your dog is having a seizure?
Well, let's introduce both these folks so we know who they are, first
All
of
right.
all.
We-
Doctor, tell us who you are.
I'm David Prue. I'm a radiation oncologist at California Veterinary Specialists.
So, specifically an oncologist for
Pets.
Animals.
Specifically radiation oncology. as
radiation oncology. And good morning to you. How are
Good
you?
morning. I'm Dawn with Leisure
Yeah, go ahead and
Fitness.
take that. Go ahead and take the microphone like a rock star. Yeah, you're the only one without one. You can hold on to it yourself. So what's going on with you?
My name is Dawn. I own Leisure Fitness, and Jack is our mascot for Leisure Fitness. And
Look at him.
he's tired because he's been still exercising.
Have you been working him out?
Yeah, so we just
So what's
hiked
the
8
story
miles
on? What's
yesterday.
the story on Jack?
Jack started having seizures in October. So he had a seizure, and we took him and got a brain MRI, and we found out he had a brain tumor. And it was actually pretty large.
Okay.
But because of where it wasn't really affecting anything until he had the seizure.
Oh my gosh, so that was
So-
the indicator.
Exactly. And so at that point, Don,
So then
you
eventually,
met Dr. Prue?
yeah. So we went straight to California Veterinary Specialty, and Dr. Prue took super good care of us. They gave us options on radiation therapy, either 19 treatments or the Cyberknife, and we jumped at the Cyberknife.
Cyberknife,
is this?
Cyberknife is 4 treatments, right?
Three treatments.
3 treatments.
So
tell us about this, and tell us how rare this is too.
Yeah, well, brain tumors are actually relatively common in dogs. We see a fair number of dogs of all ages that get tumors. Seizures are the most common symptom that a patient would have. Most tumors are not operable, and so really the only choice is to use some type of radiation treatment. The biggest problem is the normal brain does not like radiation. So when you give a course of radiation, you have to divide it into 19 treatments.
Oh my gosh.
And ultimately, there's a limitation about how much you can give. Cyberknife is a newer generation of radiation where it's basically robotically controlled and it's far more accurate. And because of that accuracy, you can give a higher dose to a tumor and you can give it in just 3 days. So what we found with dogs with brain tumors, with regular radiation, we might control a tumor for a year. With Cyberknife, we're getting anywhere between 2 to 6 years.
Oh my gosh.
I know.
My gosh, and the
And
success
there's
rate?
there's no side effects, right?
Yeah, really because you're treating just the tumor itself, we don't see any side effects. And Jack is a real case in point. He went for how far of a hike this morning?
Yeah, 8,
so
well,
8 miles or...
Jack went out 8 miles this morning?
No, yesterday.
Oh, yesterday. So
Oh my gosh. So on the follow-up, how's he doing in terms of the actual tumor?
he's doing well. I mean, we are probably about 4 to 5 months out, so there's still a long way to go to continue to monitor him. That'll be occasional MRIs, seeing if the tumor has reduced in size. But
Right.
so far, so good. He's doing great.
And I would imagine this is not a cheap procedure.
No, it is not.
No.
Yeah,
No.
yeah. All technology comes at a cost, and Cyberknife runs about $12,000 to $13,000. So it's not for every dog, first and foremost, and certainly not for every client. And we wish in the end that there would be ways to lower the cost down in the future,
Sure.
and we hope to be able to do that.
Yeah, but it's expensive technology.
It is,
Yeah.
absolutely.
All right.
Dan,
well,
there are only 2 surgeons in the country that do this. Dr. Prue is one of them
Dr.
that we
Well,
have in San Diego.
We're privileged to have you here then.
And it's
Thank
right
you
down
very
the
much.
street.
And it's right down the street, and we're talking California Veterinary Specialists. That's the name of the group, right?
That's right.
Yes,
Yeah.
but that's in North County. The Cyberknife is in a different location.
Okay.
It's right on Ruffin Road.
Exactly. So, I mean, isn't it amazing?
It is really amazing. And I mean, the technologies we've been using on humans, we are now using on our
And
loved ones.
It's a human machine, so we take
Yeah.
the people off and put the dogs on the
and
same
put
machine.
the dogs right in.
And
Well,
he's
God bless
12.
you guys.
He's 12.
Is he really?
Yeah.
Well, he looks happy. He looks like he doesn't know anything's going
He thinks
on.
he's a human anyway. So.
Of course he does.
Right?
Well,
But-
thank you so much.
I know. And
Yeah,
so
this is great.
It's great to see a dog that's had cancer that's doing so well.
Yeah.
And there
He
it is,
agrees.
folks. Yeah, exactly.
He agrees.
And
He
Dr.
says-
Prue is an amazing doctor, so,
Well, doctor, thank you so much. We'll put info on our website
okay.
about this, and I'm sure we'll probably read about this San Diego Home Garden Lifestyle, the Pet Patrol.
Absolutely.
All right, Sandy
Thank you.
Lampy, thank you so much, doctor. And thank you, young lady. We appreciate it.
I'll be a dreamer till the day